Hey YouTube muffins. I might sound a little bit bad today. I've been sounding like this since Friday. No makeup, not a lot going on, so forgive the appearance. But on Friday I had my tonsils taken out, so I thought I'd make a quick video describing what I went through and if you were to have your tonsils removed as an adult, what you might experience versus a child going through it, because it's pretty different. Usually they won't take your tonsils out as an adult if you're above 16 or so, if you don't get tonsillitis more than 3 times a year. I would get it probably every 6 to 8 weeks. And you've heard of, I'm sure you guys heard of people shopping for narcotics. I had to shop for antibiotics because I would get them so often. Every month I needed them because my tonsils would get so swollen that they would touch, and I would actually sound like this and experience pain a lot similar to this. So I had my consultation to have them removed about 2 years ago. But the hospital I work at, it's a very large hospital. This is prior to me working there. They do very large cases, so tonsillectomies weren't very common. So I was always put on the waiting list and always pushed back. But since I started working there, I was able to get bumped up. So I finally went ahead with it on Friday. Now there's other YouTube videos of adults getting their tonsils removed, and a lot of them look fine afterwards. They sound fine, they feel fine. Mine, on the other hand, weren't as easy. My tonsils were about 3 times bigger than what they should be. So the doctor said they're the size of walnuts, like overly gigantic walnuts, which is obviously not normal. And I believe that they're a little bit elongated down my throat. I didn't get my adenoids removed. I didn't, because the doctor said it wasn't necessary, which is fine. So we just did the tonsils. So pretty much for the OR experience, I am a scrub nurse, and I've worked with the doctor that removed my tonsils for me, so it's kind of strange being on the other side. But it wasn't a horrifying experience. It went smoothly, you know, concerning what it was. Even though a tonsillectomy seems like a routine surgery, it isn't for adults. Children are flexible, young, and squishy, and they're up and running within 3 days and eating popsicles right after surgery. Adults, not so much. Adults heal kind of bad when it comes to the throat area, and we're kind of big babies. So if you're over the age of 18, expect to be in a lot of pain. You know, everyone's different. Some people heal better than others, and others not as well. I feel that I'm healing okay. So yeah, if you're worried about the whole OR experience, like me, I never had surgery, though I'm involved with surgery every day. You don't remember anything. Like, you go in, they give you some either hydromorphine or some fentanyl to get you nice and high before you go off to sleep. And when you're when you go to sleep, you don't even feel it. And when you wake up, you know, I see patients waking up in the OR, and I always think, oh my God, it's so traumatizing, because they have to get extubated, because with tonsillectomies, you are put under, you are put to sleep, and you are paralyzed and put on a respirator, which means a breathing tube is either going into your throat or up your nose through your throat. In my case, I was intubated nasally because my tonsils were so big, which I guess I prefer, because that way there's like nothing, you know, sliding against where you just had surgery, which is nice. So yeah, when you wake up in the recovery room. You don't remember being extubated or anything like that. You're not going to be able to talk, you're not going to be able to swallow, you're not going to be able to do anything. I've only ever had my wisdom teeth removed, and while waking up from anesthetic, I was always very lively, and so I was writing on a chalkboard to the nurses and asking them questions like, oh, do you have any plans for the weekend, and whatever, because I know them. So, you know, I woke up pretty well. I was giving everyone thumbs up and whatnot. However, that night, for adults, you generally have to stay in the hospital overnight in case of bleeding. I was prescribed 2 milligrams of morphine for every 4 hours, but that was clearly not enough. I needed to get it up to 5 milligrams every 2 hours, because throughout the night, every 2 hours on the dot, I was waking up in extreme amounts of pain, could not even swallow my own saliva. Even now I have a little bit of difficulty, so I was spitting in napkins, couldn't drink anything, couldn't do anything, and I was getting this medication through IV. So the most I can do is whisper, but by the next day I did get my voice back. I sounded a little bit worse than this, but somewhat on the same level as this. So it's only my 4th day. They say that by the 5th to 7th day is the worst, because bleeding is more of a risk in adults. Recovery, I guess, has been going rather smoothly. I've had no bleeding. The worst part is waking up either from a nap or from sleeping, because your throat's so dry and just swallowing is the most painful thing, and I have to literally run to the kitchen, mash up my pills, and attempt to swallow them in some pudding. I wake up shaky. It is extremely painful waking up. That's the worst part. For pain medication, they generally give you Tylenol 3 or Percocet. I receive Percocet. A nice tip if you are having your tonsils removed and you're getting either Tylenol 3 or Percocet. Yes, it is difficult to swallow, so mash it up and mix it in some chocolate pudding. It completely takes away the taste, which helps a lot to swallow it. It takes care of the taste completely, because it's very bitter. It's certainly different being on the other side of surgery. I much prefer being on the nursing side, helping and assisting with surgery, but overall the experience was fine. Again, it's better to just go through this and get it over with than being sick every month and living off antibiotics, which isn't good for you anyways. So yeah, I hope I get my voice back soon. Yeah, and oh, one thing I forgot to touch on, eating. So they say only clear fluids for the first couple of days. I found that drinking water, even swallowing my own saliva, anything thin that I wanted to consume was much more difficult versus, for instance, pudding and whatnot. So I found that eating thicker substances, so pudding, a great thing is Oreo Jello pudding. Oh my god, it's the greatest thing ever. Kraft Dinner noodles was a nice one, because you don't even necessarily, I didn't chew it, I just kind of swallowed it, and it was actually soothing to stretch the throat out a bit. It's really important to move the muscles in your throat after you have a tonsillectomy, and also to try to start speaking as soon as you can, because whispering is actually more strain on your vocal cords, and you don't want to do that. So try to talk, not as much as you can, but you know, try to talk and try to eat these thicker fluids, or substances rather. Another thing is that the retractors that they use for a tonsillectomy, pretty much when you're laying on the bed, there's a bar that goes across you, up over your head, and there's a tongue blade that goes in your mouth to pull your tongue down, and another retractor to push your jaw upwards. So my tongue is still extremely swollen. You guys might experience that. Kind of looks weird if I stick it out. It's really swollen. The first couple of days it was hell, but and it's also not uncommon to have ear pain. So yeah, just try to eat as much as you can, because you want to exercise those muscles. After the first couple of days, drinking water and whatnot becomes easier, and I found that using a mouthwash with no alcohol, like Listerine Zero or Scope Zero or whatever, after you eat, you use it. Don't gargle though. Gargle's a big no-no. Do not gargle when you have your tonsils taken out. Just swish it around your mouth and spit it out, and then rinse your mouth out again with water and spit it out, and then swallow a nice big gulp of water, because you don't want any bacteria lingering around. So yeah, I guess that's it. Yeah, if you have any questions, just leave them below and I'd be more than happy to answer them. Maybe my next video will be on better terms. Love you, muffins. Mwah. Bye.